And welcome back to News Center. We are discussing the state of health in the country and asking you whether you are satisfied with the provision of health services in your county. Our hashtag is KTN News Center. Let me sample your tweets here. And Matthew Zondoro says, in Kenya, every service is a business, especially in the health sector. From consultation to the lab, to the doctor, to the chemist. In fact, one is lucky to be alive. And we have Taswira here who says, in Lamu, we are completely not satisfied because we were promised NHIF cards for free at a cost of 120 million shillings 1 year down the line, and nothing has been delivered. There are no drugs at the King Fahad Referral Hospital, and each day patients are referred to Mombasa despite the hospital having machines from the national government. Very interesting comments. Do speak to us. We'll continue sampling your comments on the hashtag KTN News Center. In studio with me, public policy analyst Robert Shaw, as well as Dr. Mesha Konguti, who is the former CEO of the Kenyatta National Hospital. Let me begin with you, Robert. Just reading, especially from the comment in Lamu there, even getting an NHIF card is difficult. How much, how much further, how much more do we have to go then to ensure this access to healthcare for all?
Well, that's a very good point. It's not just in Lamu. I've seen it with different people that I've worked with, and I've said to them, have you got your NHIF card? And they say, no, but it's such an exercise. I've got to go here, got to go there. There's a lot of bureaucracy. So what we've got to do also is make it more accessible. We've got to, like in a lot of parts of government, a lot of that bureaucracy is unnecessary. I mean, the right to have an NHIF card is your right. It's not a piece of gold that you're giving. And so the government really does need to improve that whole service. And again, cut out the mismanagement, the corruption, because quite often that's it. You can get it, but you have to pay for it. You shouldn't have to pay for it. I mean, this is a right. I mean, this is what, in the end, we're paying our taxes for. So I think we need to turn it around and say the government has an obligation to improve and streamline it.
Absolutely, and it does. I mean, it is part of the Constitution. But Dr. Nguti, let's refer to the countless strikes that we've seen within the medical fraternity. Nurses today, clinical officers tomorrow, doctors the other day. And this has crippled healthcare. In fact, it has had major health repercussions for pregnant mothers, for example, who did not get the right healthcare, for babies who did not get their immunizations. But is this a leadership crisis within the county government, within the national government, rather, the county government, or within the doctors' unions and boards themselves?
First of all, it is sad when you find that the medical profession have to resort into industrial action or going on strike. But I also do understand the reason why they do that, because you see, under the training and under the oath that they take is to offer the highest standards of care to their patients and make sure that whatever they give the patient, it's both of safety and it also brings in good outcomes and doesn't bring complications because the liabilities lies on them, and they have to look at them, they have to assess on that particular aspect. What I think has gone on is that, and this is why I say that we have deviated from really what the healthcare service is supposed to do. And I do agree with some of those comments. We have looked at healthcare as a business rather than as a service that is supposed to help people. And when you help people to be well, then they can be able to actually go and work and improve the economy of the country. So, in one way, and you see also when you look down on the people who take care of the patients, whom you trust, communities, you trust the country, the healthcare of the country to those particular people. It's so important that you engage them so that they can be able to tell you what their problems are and how it's supposed to be sorted out. And I think the unions have come up as a result because they found that there was no forum. Things are prescribed. You remember, for example, in the colonial time, where they would just come in and say, you don't know what you're doing, do it this way. they prescribe for you what to be done. That time is not there. That prescription is not supposed to come from the top. Because you see, the top does not know what actually is on the ground, what the problems are supposed to be there. So, I cannot think of when, there might be one or two or three or a few all over the world of a group of professionals who will actually go against the ethics of taking care of those patients. But they also not take risks. For example, if they were going to do a cesarean section you remember that one of the things that we have been worrying so much is to bring down the maternal mortality as a result of cesarean section, for example. You will find that if a hospital did not have the facilities so that you can do safe surgery, and most of the people who have that, you will actually, if you followed, if you checked, you will find that they have taken risks in a that emergency, so that they can be able to have that particular. But they did not have the basic, this is what we call the basic standard of care, which must be across, whether you are in Lodwar, whether you are in Lamu, whether you are in Kisii, or you are in Migori, or whichever place you want to be. This is the part we have not reached to. We have actually not found that this is supposed to be the case. So there has to be a shift in terms of leadership. What I mean by leadership, leadership doesn't necessarily mean you just command. You are there at the upper but you involve the teams.
The approach.
Now, and unfortunately, what happened is that when you look at the doctors, wherever they are in, because one of the things that yes, it was good to develop healthcare to the regional areas. But remember, how do you maintain those standards across all over if you disconnect it from central, whereby there's laid down that for this particular facility, this is what you're supposed to have, not the what's supposed to be done at that level.
Right.
So really, and then again, you see, when you look at both the national government and the county governments, they looked at the money going to the county governments, but they forgot that money was either for paying they looked at it as something that now how do we control it? So they actually completely put aside. Up to now, I'm sure that they put aside all the medical provisions. That's why you find nurses come up, clinical officers come up, doctors come up. Now, we can't work in those kind of scenarios. We are a team. We are a team that must be able to work properly. The moment, you will never have strikes if the medical provision was properly incorporated and assisted. And they advise even the national government, they advise even the county governments, and they advise even the hospitals that look, this is what works best.
A section of medical stakeholders say the best way to do that is through the establishment of a health service commission, an independent body that will oversee the medical profession as it is. Is that really the solution to this problem?
It is good to have a body that will ensure that you have standardized care everywhere. But again, here is that, you see, you can duplicate. But what kind of leadership are you going to have there? Whom are you going to put in that particular place to ensure that, look, actually, he will live to the task. He will be a person who changes. Because if, for example, you move someone from the Ministry of Health, right? Or you move someone from somewhere else, you're not helping a great deal. You really have to look at it, look, how do we must move out of the box. Because what is happening is that we are not ringing up our territory. We are not competing. We are supposed to work as a partnership to ensure that we offer the services on. The Health Service Commission is a very good idea, but so long as it's not going to be a fight, for authority, it's going to look at it, it's going to be a service delivery. It will ensure that, we have the standard, we are taking care of the prevention, we are taking care of the non-communicable diseases. For example, we are talking about cancer right now. A lot of those cases are on place. Everything is coming out from every place.
Let's bring in Robert and touch on the issue of quality that Dr. Nguti talked about. Many times, you find hospitals are there, yes, but the very basic of equipment is lacking. And that has forced a lot of Kenyans to also seek specialized medical treatment outside the country. Sort of a clear statement or a vote of no confidence on Kenya's healthcare system. How do we remedy that, and how do we approach that as a whole?
Well, I think quite a lot of that has to do with an improvement that has to take place within the private sector, because, you know, quite often people will say it's cheaper to go for an operation in India than it is to have it here. It's not because we can't do it here, we can, but we're charging, the private sector often is charging far too much. It's extortionate. And so I think that when it comes to that's the answer. On the public sector, I think something we've got to also invest in is the people that are there. If you look, we've all seen it. You go into any dispensary, you go into any government hospital or whatever, and morale as well is missing. You know, you look round, they've got it all wrong. There's plenty of sweepers, there's plenty of cleaners, but you know, there's the one or two doctors or nurses that are there are overworked and really just stretched. And if you were to manage to sit them down for 5 minutes, they just say, you know, we've been forgotten. So I think the key people are just being neglected, the point you were making. You know, we've got to get back to it and also take the politics out. This fight between counties and whatever over, you know, this is not a piece of, you know, booty that they're entitled to. This is healthcare for the people. It's not, you know, this power politics thing is really disgraceful.
Dr. Nguti, your thoughts on that, even as Mark Kipsang here on Twitter says there's lack of goodwill, support and nepotism, which is killing our health sector. Human resource in the Ministry of Health, in the sector rather, should be managed by the national government. Still taking us back to the same conversation and the same argument. Let's bring this to rest, fine, I mean, once and for all. How was your experience at the Kenyatta National Hospital, largest referral hospital in the region, even as the scrutiny continues on the state of public hospitals?
It was a mixed experience, I'll say that, in terms of, you see, that hospital performs 3 major functions. One is to offer services to the people who are sick. The other one is for training, you know, all the medical cadres in the country, so that you can be able to have continuity of service, having all the doctor coming up in all specialties. And the other one is to do research. The research so that they can help the policies that are supposed to be the case. And unfortunately, what happened is that, you see, the moment we deviate from those core functions, and that started coming in when you find that people are more, they look at the hospital, they look at how much money comes out of a particular hospital, and they want to see that how can that money be of value to other things rather than taking care of the patients.
Right.
And I'm using that as an example, but it's all over. That's what you'll be able to find in. Because you see, in the Western world, for example, you will find that people are moving away from building big complexes, big hospitals, because it's not the beds. Because we are trying to discourage and have what we call, you know, the primary health care, that prevention, and ensuring that from that, so that we can be able in future to, because you see, if you have done that properly, you will have no patients in future to actually fill those hospitals. But, and you see, if you look at every county, for example, wants to come up with a huge, big rural hospital. Now, they have never, even in very high income countries, they don't have so many centers of excellency. They actually have centers scattered all over the country so that people can be able to, if they start special need for them, they go to that particular place. Now, what has also happened, and that's why I would say that I think healthcare, in terms of human resource, should be centrally controlled, is that when it has gone down to the county levels, there's also nepotism that has come into place. That you want to employ someone from that particular area, all because, you know, and you see when you begin fragmenting healthcare, that you can only be taken care of where I come from, then you see you have lost it. What here requires to be done is to go back, like in the times of the earlier times of colonial, I mean after independence, for example, you'll find that people will go everywhere in the country and offer services. But right now, you are looked upon that where have you come from? So on that basis, let us not really be thinking that, and that's why I would say the Health Service Commission would be a very good idea, so that they can be able to make sure that they have coordinated care everywhere to ensure that there's no deficiency in that particular area. And now, when you tell the county, they are not, if they have the expertise in terms of determining the human resource for health in that particular area, if they have the expertise to understand the dynamics of the healthcare in that particular spot, then we understand. But you see, they do that. And in fact, what I've realized is that, you see, we focus so much on the doctors or the nurses who are supposed to be there. But have you ever asked, for example, that what do the healthcare departments in that places, I mean, in the counties do? If we did an audit, you'll find that in almost a whole year, a lot of their time is spent on meetings out of that particular spot.
All right.
Spending money, to come in that place. And you see, we could say that the patients will not have the money to do the further things in. And that's money that has come with the service on place. Even the national government. Why should we, for example, have someone from an office, let's say, I'll use an example, going to meetings almost half of the year, and yet he has not even gone to the ground to see what's being done. All
right. And these are very pertinent concerns, of course, being raised by the medical fraternity. But even as we wind up this conversation, Robert, universal health care, or the quest for it, still continues in the country. What must Kenya get right in order to achieve this agenda?
It's got to be more realistic. You can't keep going around talking about the big four. It's just not attainable. What you've got to do is lower your sights and say, right, what can we achieve? And then go literally back further and look at what we have and say, how can we, within the limitations that we've got, the resources that we've got, how can we improve the management of it, the distribution of the drugs, and I think there's a lot of room for just improving. Forget the universal thing. I think the word should be improvement of healthcare services, and I think there is massive potential there, even within the current budgets. Just literally going through the system, like you would do it, for example, in the private sector, and say, right, look at that. How do we improve that? How do we get that better? How do we get more drugs in? What is it that's the problem there? Is it the cost, or is there something in the purchasing side which is bureaucratic or whatever? Right. So I think we literally, it's fairly boring detail in a way, but that's where we've got to work, because we certainly can improve considerably. But let's stop talking about things that which are basically in a dream world.
Absolutely. Dr. Nguti, in a nutshell, as we wind up, it's not just access, it's also about quality and the cost of it as well. What must be done to ensure that these three things are the focus on universal healthcare?
That's what must be done first, to focus on those things: access, the quality, affordable, is safe, and is efficient. That means, all those things concerned in place. I think what we need to do in this particular aspect, particularly for the private sector, I think the private sector must be able to not look at patients for a source of income, whereby they have to do other development projects. I mean, I'm saying this, for example, that if you looked at, for example, the insurances, where they refuse to pay for certain, where someone is registered in, and yet they are able to go on projects that are totally different from, like buildings and whatever is supposed to be the case. You see, if they are doing that and they are not paying the various players who are actually offering services, you discourage them and then nothing goes into the places on. Number two, I do not know why, up to this age, for example, that look, if you look at the number of Kenyans who are using, for example, who will be able to use services, the drugs and whatever is supposed to be the case, surely those quantity, if you were to do bulk quantity, I know there was KEMSA, but you see, one of the arguments that has been there, that why should they buy from KEMSA and yet they can get those drugs cheaper outside than anything else? I don't understand why, for example, that counties could not be able to come together and say, look, let's purchase or let's get things out volume discounts so that everybody is able to get it, so that the patients, The basic things, if the doctors are utilized properly, they will be able to tell you what is required. So if you are in the store, patients don't have, remember maybe you are an emergency and you go and you find that the drug is not available. Or at that time, the insurance is wanting to, they have approval. You know, we have moved away from the core functions. The insurance was supposed to make sure that you get services immediately. They were not supposed to, again, control what they are able to offer you. And that's a wrong thing. You see, our role is we are only accountable to the patient. We are actually not supposed to give information to the third party. But now, we are being forced, and we are doing it illegally. Because actually, the patient, if, for example, you took that insurance that you refused to offer me these services when it was needed, then again, the private institutions also, they must not be able to utilize the money that has been paid if they should take care of the doctors, the nurses, everybody properly.
All right.
And not use the money for other purposes. At the end of it, you find that they become disgruntled and they can't be able to offer services.
All right. It is a conversation that needs much more time, of course. That's one that will continue to go on. Very, many thanks for coming to our studios this morning. That is Dr. Mesha Konguti. He is a medical doctor, former CEO of the Kenyatta National Hospital. Also with us, public policy analyst Robert Shaw, discussing the state of health in the country, even as we ask you whether you are satisfied with the provision of health services in your county.